Good morning, everyone. We will get started in just a moment. Just waiting for a few more people to join us, and then we'll get started. All righty. Good morning, everyone, and welcome to our session, Commitment to a Culturally Responsive Mental Health Care System. I am Dr. Brandy Holloman. I am one of the TA providers with Intact, representing Change Matrix LLC, and I have the pleasure of introducing Stacy Morgan and Jessica Aguilar. So I will quickly read a little bit about them. Jessica Aguilar is a strong advocate for families and children in special needs in North Carolina, and she's earned the trust of the Hispanic families and community by serving many roles as an active voice for families. She's a detail-oriented, innovative, and passionate individual with over 5 years of practical experience working with families, children, and community health-based organizations desiring employment in an organization that will utilize strong interpersonal skills and commitment to advocates for equitable outcomes for all. Stacy Morgan is a parent of an adopted child and young adults with special needs, and a consumer supporter or advocate with over 20 years of opportunities to participate in planning, development, and implementation of services for populations with special needs, especially in the arena of mental health and disabilities. She served as a consultant for many years for various programs, and is currently the executive director of the Mental Health Transformation Alliance and coordinator of the Family and Youth Center of Excellence, Authentic Voices. Welcome, Stacy, and welcome, Jessica. And you may go ahead and get started.
Thank you.
One quick thing. I'm so sorry. One quick thing.
Okay.
If you all can make sure if you have questions, put that in the question and answer section of the platform. Those are the two bubbles with the Q and the A in it. But if you want to say hello from Oregon or Kentucky or Georgia, you can do that in the chat. But for any questions for our presenters, please put that in the Q&A so we can manage those properly. All right, so now take it away, Stacy and Jessica.
All right. Thank you, Brandy. So welcome, everyone. I am Stacy Morgan, and I am going to, like Brandy said, question and answers and the question and answer, but I recognize some of the names on the participant list, but if you have not already done so, please go in and state where you're from. So Jessica and I know where we are talking to. We are both from North Carolina, so you will, so that is where we are speaking from. But welcome to the presentation, Commitment to a Culturally Responsive Mental Health Care System. You can go to the next one, Jessica.
Yeah, I want you to have in consideration during this presentation, please allow yourself to think aloud, explore different scenarios and thinking of certain situations that you experienced in the past. It's possible to feel uncomfortable during this presentation, but it's okay. Allow yourself to have a space to step out and be comfortable and respect the other stories and through the opinions.
So today we're going to kind of walk you guys through some of these target areas, how to promote collaboration between families, providers, and agency to bridge gaps in mental health services, and how to foster understanding of the importance of tailoring interventions to specific cultural backgrounds. And then finally, recognizing the unique challenges faced by families, including those with diverse cultural backgrounds. So, as everyone knows, as we grow, as our population grows in the United States, it becomes more racially and ethnically diverse, right? We're across the board in every state across the nation. System of care and providers that provide services and supports in communities need to respond to communities with varied perspectives of values, perspectives, and behaviors about the health and well-being of the families and the individuals that they serve. Failure to understand and manage social and cultural differences may have a significant mental health consequences for those minority groups. And you'll learn a little bit more about that as we move through the presentation. And I know a lot of you already know this, but we're going to review this to kind of set the foundation of where we're coming as far as when we introduce the concepts we're about to introduce. You know, a system of care that is a spectrum of effective, you can go back one, just a minute.
Oh, sorry.
You're okay. Go back one more. So system of care is effective community-based services and supports for children and youth with or at risk for mental health or other challenges in their families. It's organized into a coordinated network and builds meaningful partnerships with families and youth and addresses their cultural and linguistic needs in order to help them to function better at home, in the school, in the community, and throughout life. So that's the foundation and the perspective we're going to take as we move through this session. Go ahead, Jessica. So, one core value of that system of care concept is being culturally and linguistically competent. And that's with agencies, programs, and services. They need to reflect the cultural, racial, ethnic, and linguistic differences of the populations that individual or that community serves. It facilitates access to and utilizes those appropriate services and supports. And when we say appropriate, we also mean culturally appropriate. It describes an approach that values and respects individuals' backgrounds, experiences, and aspects of identity, all of which influence the impact of an event on a person. Culturally responsive care recognizes barriers that prevent marginalized or stigmatized groups from being engaged or participating. Go ahead, Jess.
Okay. Well, I don't want to explain you all the concept, but I want to see there is a different concepts about cultural. Everyone knows the cultural is like a whole thing, the norms, values, beliefs, behaviors, and ethnic or cultural group, and have the cultural knowledge about it, and learning in the school with social studies and start learning. But then need to be cultural awareness and understand these groups, but then coming up the cultural sensitive is the difference between the cultures and need to value the difference between the cultures. Then coming with cultural competency. And cultural competency is the ability to understand, embrace, and genuinely interacting with individuals or organizations that bring you the system of the behaviors, attitudes, norms. And it's like you can see like how can God changing the concepts and be more and more awareness, because one thing that need to have in consideration is not enough only know about culture, need to be more conscious, need to be more awareness, need to be more competence, and encourage the cultural humility, because this is essential to increase the access to improve the standards of care and don't traumatize children, families, or communities across the nation. One thing they have in consideration is that it's essential to increase the access to improve the standard of the care and response to understand the need through the level and organizations and addressing the needs the families and kids. Some cultural influence is the meaning we mean experience, sense of belonging, or strength or resource and resilience, or expresses with discrimination and oppression, what we find helpful and healing, the beliefs and traditions that draw open, whether that we feel respect and understand, and we feel someone is being genuine, and how behavior is interpreted by others. What that means, this cultural influence is like, it's not only the or ethnicity, it's about more than that. It's about our experience. It's about of feel that be part of this. Maybe it's not my same ethnicity, but I feel that I belonging to this organization, or this clinic made me feel comfortable, made me feel that I can come in there and be open with me. That's the things that need to be considered when you're talking about the culture. Culture is more the ethnicity, it's more the norms, it's more the a lot of stuff. He considered our experience, he considered our feelings, our belongings, our resilient, and how can feel like with our traumas and experience that coming with a lot of changes that come in with us, and the past the time you're growing, and the cultural that you have, your norms, your stuff, go changing with you. And what cause gaps in across the culture? Have the cultural norms and beliefs, and this is influenced by seeking different norms and misunderstanding and resistant like approach. Like some people have kind of norms and beliefs. Like example, I kept thinking the Afro-American woman is a strong woman and they don't suffer so much because they are strong. But that's a belief that exists. This is a norm that thinking. But not always is promote an open discussion about mental health, about what they feel, because these norms rigid the culture. Or example, Hispanic families, the norms is you can say nothing outside of your house, outside of your family. You can tell your feelings at anyone because someone can come and making fun of you or making like bad things from you. The language or communication the barriers. You have a problem that if you can explain yourself, you're scared. Like it's not only it's across the people that attends, it's like the people that go to the services. Like example, I'm scared always that I have a presentations because my thinking is they can understand me, they can understand my accent. I don't know if I some words that I needed can say that or pronounce well. Like that coming with me, that bias, that stigma, that scare, and go to the one place and the person say, "Oh, I don't understand you." My anxiety, my depression, my everything can coming up, and I start to say, "Okay, this is not communication. This is a barrier that can handle this situation." And then come with cultural stigma and taboos. Oh, probably they don't want to understand me. Probably I speak well, but I have a little accent, and I can. And coming with these ideas, they it's not only the person that go to the receive the help, it's also the person that give the help have these gaps in the culture. The individuals seeking this feel like a fair, like judgment, excluded, and then coming with historical trauma and cultural resonance, coming with how oppressed be our culture, like our ethnicity, how you feel that, what is the like generational traumas that bring that with us, like how can this affect us every time they go with one organizations asking for help, or asking someone to wanna making a therapy and see it's not my same culture, it's differently, and it's like what trauma I bring that is coming for generations with me. Then have like social disparities, and this part is like affect us in the backgrounds, the unequal access to mental health resources, the challenge the collaborative identify options to mean a fair access of the treatment. That part is very important. A lot of families, a lot of people don't have the resources, no have insurance, no have uh, economic situation for pay to go to the therapy, so go to the one organization. The other thing is failure, failure, failure to build trust. It's difficult building the trust when you don't feel that you are identified with the people, when you feel alone, when you feel that people don't understand you, or make you feel microaggressions, because sometimes don't make it with intention, but sometimes you say some things that people feel offended by his culture, by his norm, by his beliefs, and it's hard for them like making that connection and making that trust and building that trust. And that part need to have in consideration or situations further in the presentation, see about like how can our position making a difference in knowledge or situations can help us to building a trust with the families or kids or youth they want to help. Bring the knowledge the gap. The cultural competence is learning to skill routing education and self-awareness. Educate yourself about diverse cultural backgrounds, the capacity to provide empathy and affecting care, acknowledge the approach with humility and respect, making a big gap. That have that knowledge can help us to making a difference for have the services and have the support for the families or kids. The cultural informed assessment. I don't know if you have access to the documents, or I can share that in the, let me see if I can share with you.
They do have access to the documents
Okay.
because they.
Well, in the documents, you can see mecha diagrama. This is immigrant family respondents. This is a transition, the community and clinician. they explain a little bit how can you making assessment more cultural empathy and have in considerations things that probably you don't have in consideration because it's like part of the culture. Like the families that come in with Latin America, they come in and have immigration situations. They lost his families. Probably they lost people in the when they come into this country in the desert, or a lot of different kind of stuff that normally you don't think about it because it's not part of your reality, and that's affect to these families and making harder for them sometimes express themselves or take out what they feel or how they feel, and have this process and having consideration and see the like family life cycle, the ecological context, the migration and accumulation, that help you to understand more the dynamic, the family that this person, the dynamic, the life that this person, they make things more easy to working with them and have in consideration and the assessments making have the background that you need. Then the cultural breaking is like community leaders play a vital role because you know that if you are very like religious and your church say, oh no, mental health is nothing, it's like God help you and God is stay with you, you don't need anything else, you don't need the go therapist, change it. Thank God it's not like that. But the leaders have a big impact in the families and the people, and it's very important have a good relationship and collaboration with leaders, the different organizations, to promote and help you to connecting and making this trust building for recognize and understand and addressing these gaps about cultural and the and making more easy to generate other helps and programs. Sorry. Okay. The cultural impact and mental health. The cultural beliefs about mental health illness. That's influence to interpret the health symptoms. And people interpreting the symptom, including cause them like don't go for help. The cultural relates is the people that cope and be upset. That's make them don't try to find the support that they need. The cultural stigma and mental health is the sometimes the system be racist and oppressive and underestimate the mental health treatment for many cultures and many conditions. The negative attitude of belief can fear discrimination. And that's the stigma they're talking about early. I go with the stigma that probably this person don't want to understand me or don't understand me because it's not my same ethnicity or don't speak my same language or don't making enough for try to help me. And the stigma that I can be like I need to be strong because if I'm not strong, the people can making things from me and take away things from me or put me in a one facility and I don't want to be there. And it's like have a lot of stigma around the mental health that is very hard to take away, even if you go with someone that your own culture, because it's something that is so inside to us, they even don't recognize sometimes. And the family support is and the treatments are so important. The cultural influence is the help to the religious leader, the doctors, like the community, making more easy or more hard the people funded the help that they needed. Like, if my family thinking the mental health is a weakness and I can express myself, I can say what I feel, I can put my feelings out, it's more hard for me try the funded help. It's more hard for me try the people understand my feelings and start close and close more and more until it's a point they can't resist anymore. And the community making the situations better or worse, depending how can the community be relative to these symptoms, recognize them, and help them. Is people they sometimes say, "Oh, why are you acting like that? You are crazy," and make them feel like, okay, I can say or I can talk, because making feel bad other people, they thinking they I'm crazy, they thinking they am bad, they thinking they am a violent. It's a lot of connotations that coming down. And the other thing is like the physical health. Normally in the cultures only check if need to go because something is hurt, because something is wrong with our health physically, but not have in consideration our mental health, don't have in consideration our feelings, because have to be strong, have to be easy to management, have the working hard, have the making all this stuff that coming for our beliefs and the norms that our culture. And everyone is different, everyone live a different things, and everyone making a different suggestion, and it's just like a big barrier. And if you see the statistics, um, the mental illness by race is like mixed multiracial is like 34%, and Indian American 26%, white 23%, Black and African American 21%, the Hispanic is 20%. And I asking you something. Do you thinking there is really only 21% for Hispanic, or only 21% for Afro-American?
And Jessica, this is 2024 statistics. Am I not correct?
Yes.
That's what I thought.
That's you really believe that, or you thinking there is the people don't try to fund the help, the people don't try the making a different support. A lot of people funded support in the churches, go to the like religion, the different kind of religions, or alternative holistic things, but don't go and say, you know what, I thinking I need to go with one psychology or psychiatric, or because they feel that it's not that way, it's not what they feel, that's not comfortable for them, they don't feel they want to find the help that they needed. And that's coming with all cultural barrier, the language, the beliefs, the miscommunication, the misunderstanding, that all making a disagreement and conflicts and different beliefs and values. The communication barrier making a big factor to affect the exchanging and understand messages, and difficult the obstacles and the physical environment, the barriers or physical limitation and the communication process, like, because you don't only talk for words, you communicate for with your whole body, with your whole person. I can communicate with my hands. Every time that I'm talking, I need to move my hands because it's like it's from my communication. It's from that I can say, "Oh, it's this, it's that," or "No, no, no." It's like I need to talk, and I need to talk with my whole body, and everyone talking with the whole body. And you can see when you working with a person or talking with a person, you can see in his body like what they communicate to you. They communicate they are comfortable with you. They communicate they are uncomfortable with you. And have other considerations. The communications is like some people don't talk. Some people is like sign language. Or some people is how can you address in this barrier? How can you help these people to communicate and connecting with you? This is a very important have in consideration that have the cultural but have other barriers they coming with, like communication barrier is one of the things that making more harder the approach to the families, because some language don't have the signification the words. Some language don't know what is depression because it's no exist that word in his language. How can I explain to someone depression if in his own language don't have depression? Need to find that the way they communicate with them, what you want to try to say to them. And sometimes when you communicate, you need to communicate like in the language that they understand. Like, oh, you feel sad, you feel like a hole in your heart. Everyone feels like that. Everyone lost someone. Everyone making something they regretted. It's like need to communicate the different ways, and even sometimes you need to tell stories for they understand what you need to say.
And Jessica, you mentioned to me one time, and I don't know if it's on this slide or what, but that even having an interpreter, like there's no trust there, that's also a communication barrier. Having that interpreter, because you don't know if what you're saying is actually being portrayed. Am I?
Yes, it's like the point is like, yes, you can say, oh, I have interpretation, but what happens if this interpreter don't know what you're talking about? And how can this interpreter can explain to this person and making these stories? Because I told you, if don't exist that word in the language, you need to explain by stories, and you need to explain the other ways. And interpreter need to know what he talking about, and need to be prepared and be cultural humility too, because I'm the Salvador, but if you speak with me and speak with someone in Mexico, I sometimes don't understand one person in Mexico because they speak differently than me. And it's like the same language, but they can communicate sometimes because it's a different words for different uh, objects. And it's like need to be carefully and be very understand that and say, oh, no, like sometimes use it synonyms, that same word, because it's like for me it's like pajilla, the or for Mexico is popote, and it's like a different words. And that's the making, like, be knowledge and be like humility, and say, you know what, I don't know your culture, but I want to learning with you. If you love me, I can learning with you. What you prefer? You want interpreter? You want this interpreter talk with you like tell you everything they say, or you understand and you only want the interpreter speak for you? What you prefer? What you need? Then coming with the physical barriers, sometimes don't have in consideration the physical barriers, like the noise. Some people don't like the noise. Some people don't like dark places. Some people sometimes don't like the slow music. Like, need they have in consideration the physical barriers. And sometimes the people need accommodation in the place. It's like, if you go to the doctor and you're in a wheelchair and the doctor saying, okay, sit down in the bed, it's like, hello, I can do it. I need help. Or I don't want that you touch me, or I don't want that you have this music or this smell. Or need to have in consideration to the physical barriers, because maybe for someone culturally can be perfect have a slow music, but for other person can be stressful because don't like it. And this is like part of the culture, part of the need they have in consideration, because like making difference not only for ethnicity, is also for what they people live and what they people feel and what they people is. I can have autism. I want to go to with you, and I can handle it the lights that you have. I can handle it the sounds that you have. I can handle it the smell that you have. Like, need to be have in consideration all this stuff, because the behaviors coming down with all this. And it's part of our culture, because my culture is to be autistic, or my culture is to be with Down syndrome. Part of my culture, part of my person, part of myself is this. The emotional barriers, and that's emotional barriers coming big with the stigma and the bias they have all the persons. I go because I feel bad. I go because I need help, but I don't feel comfortable. I don't feel that I want to go there. I'm stressful. I'm scared. When I start the presentation, I start scared, and I feel that I can speak for myself. Like, I feel like, whew, very down. Now I coming up, because that's the happen. When you feel scared, when you feel uncomfortable, when you don't feel that it's like your way, that you can express yourself, you feel uncomfortable. You feel alone. You have fears. You have stress. You have anxiety. And these people coming with all this stuff to you, and you don't know what this person live in his life, and can come in mad, can come in with a lot of stress and screaming to you, and they don't made it because they want to hurt your feelings. They made it because it's the reaction that they have and the moment that they have. And that's why one thing they always need to have in consideration is The people respond by his traumas, by his life, and by his bias and the stigmas, and need to have in consideration this, and need to talking with them, and need to make them feel that you be there for help them, you be there for hear them. Is they say you have two ears for hear and one mouth for talk, because you need to hear more than one you need to talk. And this is like that's the sometimes people need for making away this barrier, this emotional barrier by his culture, because they go with the stress, they can make me don't understand me, or the person that isn't they enter, they always make me a big face and treat me bad when I ask him for my appointments or my documents, or like all that is like everything. The moment the person go to the one organization or go with one person, they enter to this place, everything counting, everything making feel differently, everything making feel the cultural barrier is there because they don't understand me, is there because they don't see me, is there because they don't try to talk to my language, is there because is no one like me in this place.
And Jess, I wanted to let you know too that we have about 10 minutes left to before questions. And so if there's anything like real, like that stands out to you that you feel that people should know about culture, like what would that be? Like what would those be? And there's a lot of questions in the chat about how do they integrate this into their services, and if it's other cultures. Culture across the board is culture, whether it's Spanish or African American, Indian, veterans. There's also community culture, and you have to pull off from those cultures and those communities to be able to provide those services, integrating those values and those needs of those cultures into the services that you provide. So I'm going to let you expand a little bit more in the next few slides as we move. Like, how do they do that? How do they be responsive to that?
Yes, it's like well, you see here, like, see there is a lack of diversity, is a lack of communication, the racial and trauma bias. But I don't know what happened with this one, but he moving. But example, that help you a lot. They understand the cultural responsibility, like what is the behavior, recognize the background, the culture, recognize the feelings, be unique in the approach that you made it with every person. Every person is different. Every person is have different feelings and different life and different things they live in. Try to be understanding. Moving to the traditions. Have in consideration his traditions. Bring that to the place. Oh, what you like it? How you like the music, or what kind of stuff have it? Like asking them, be humility. Like I can asking what I don't know. That's the most important thing. I can need them making feel that I'm there for there. I don't know. I know that I don't know, but I want to help you. I want to be with you. I want to feel that you feel belong to this place. I want you understand that here is the place that want to try to help you. And how you can make me feel that, like recognize my context, recognize my culture, recognize my uh, place. I feel bad because I'm be in a different place than you. You have a lot of privilege. I don't have this privilege. It made me feel scared because you can use your privilege to making something to me, make me feel that I'm not in that position, that you know in that position, that you don't use your privilege to make me feel less, to make me feel that I can do it, the things. Embrace the culture competency, the holistic perspective. Bring these holistic things. Sometimes it's good, like bring these things. Like, oh, you know what? I hear there is a yoga place that you can go if you want to, and bring that. Bring that part of these ideas, and don't take away, making this take away the stereotypes, the thinking, oh, the Hispanic families never say nothing. They always agree with everything because they don't speak nothing. No, they don't speak because they don't feel comfortable. They don't trust. They don't making the things. How can I make it this trust? Take away the stereotypes. Don't thinking that everyone is saying, working specifically with the person, navigate with his language, navigate with his traumas, navigate with the bias that they have. Everyone have it, and everyone respond to that. I want to pass some key points. This is very important. They continue self-educate about the culture, open and listening, reflects making a flexibility therapist approach, making a relevant language, the assessment, have the considerations, the cultural assessments, the treatment, the planning, be cultural humility, and reflecting and adapting. And you see in the papers, see one test that you can make it for yourself, the diversity culturally self-assessment checklist. And you can see that's not like a wrong or good. It's like you can see how you feel, how you have, what is your situation, and based on this. And if you have knowledge that your situations, that your position, is more easy to help the people. It's more easy to put in their situations and be more empathy and be more vulnerable with them. You can feeling from facts, learning your own unconscious bias, listen to stories the others, making a safe embrace spaces, be actively educate yourself, making groups and be with groups, the people, there is a different ethnicities, different cultures. And this is the part, the social, making social identity wheels is very important that you know yourself and you have in considerations of this. What is my ethnicity, my race, my religion, my sexual orientation, my gender? And have this social identity wheel in your mind, and you know yourself, and you know what is you need to support your people, the people that come to you and asking for help. I have a bias about the gender. I have about bias about the sexual orientation. I have a bias about the religion. How I, with you learning who you are and what is your social identity, help you to help others. And if you knowledge and learning the social identity, the people that go with you, be more easy for you connecting and create that trust, because you know this person probably have a religion bias or a language barrier, or a problem with his sexual orientation, like they have a bias for that, or they don't like some stuff, and that makes you connecting with them and understand them and see why the reactions are like they have, and then see your will, your power. What is your privilege? Probably you and the circle inside, and the people that you working is outside, and you don't know what is be homeless, and you don't understand that, and you need the asking them, how can I help you with this? How can I understand you? Let me know, let me understand you, let me know, have the knowledge for help you, because it's different. I'm being this power and this privilege, and this person don't be in this situation, and be more conscious of that, and be more conscious that what I live is not the same. If it's not the same, I need to be more empathy and hear, and try the thinking how I feel if I live that situation. Having consideration. Families are different. In different backgrounds is different. Completely change it. It's not anymore mom, dad, kids. Is grandparents, kids, dad and dad, kids. Is change it. Everything is changed. Need to be more open into the changes, be learning more about the dynamic the families, understand the backgrounds that these families, try that don't making microaggressions with them, try that don't take away, bring the stigmas, the stereotypes, and need to be more opening to hear more the talk. You need to have in consideration what is the family functions, what is his fears, what is his goals. Some people, the fear is they don't have a status in this country, and they are scared. They don't try to go help funded the help for mental health because I'm scared that someone can send me to immigration. Why I come to this country? I come to this country because in my country is a war. I see a someone dying. Um, the my stay try to fund me for kill me. What is the worst of them? If they have kids, what his diagnosis, how they feel about it. They are agree. What is the process that they have right now? The environment, the families, what they dealing. They have for food, they don't have food. Sometimes bring these things too. Like, you know what? I'm a doctor, but if you want, in the front door, I have a lot of resources for you. If you need food, if you need a place where you go to live, if you need medicine, if you need other kind of therapies, it's a lot of considerations. You need to making a pause on your agenda and have acknowledge first the person, hear the person, and learning about their situations.
So you can go to the next slide. So we have a few questions, Jessica, in the chat that I'm kind of just going to go through for a couple of minutes. And here's our contact information should you want to reach out and have additional questions or have something that we don't have time to answer today that you might need answered. So first question is, do you utilize traditional workers, community health workers, or peer supports to help with being a cultural liaison? I'm going to say, as my organization, Mental Health Transformation Alliance, yes, We try to provide support to families and individuals through an individual who has same like experiences as them, that being navigating services experience and cultural experiences. So yes. And Jessica, do you have anything to add to that one?
Yes, it's like one thing that I have in consideration is like live similar things, but not live the same. But the point they have someone that lived something similar to me made me feel more open, made me feel more alone, and made me feel more less fearless. And that helped a lot. And have
Uh-huh.
that services in the different areas be wonderful.
Yeah, and you can call them cultural liaisons, but you don't have to. Your family partners, your lived experience positions, they could be anything. So you don't necessarily have to call them cultural brokers, as long as you're building your staff services and support that reflect your community and the individuals that you serve, like Jessica talked about earlier. All right, the next one is, what strategies do others utilize for integrating cultural values into services provided to include, such as for Native Americans or military veterans or families? So you guys can answer that in the chat, so that we're getting a variety of answers for that one. And then specifically, what strategies are used by others for training staff on cultural awareness? So you can answer either of those in the chat, so that we're getting this individual is getting a variety of answers. But as far as this goes back to know your community and know your families and the individuals that you are going to serve, and make sure that your staff reflects the culture of your community, that your services reflect the culture of the community. Then, as far as training staff on cultural awareness, if you have somebody in the community can do that. If not, then you can either seek someone, or there's a lot of online stuff. And someone asked a little bit ago, checklists and stuff like that, and self-assessment tests when it comes as far as culture, that can be utilized with your staff, that you can adapt and take and utilize it in your organization. Jessica, do you have anything else to add to that one? We have about 3 minutes and we have a couple more questions.
The point is that what I say, need to have in consideration other organizations. Like if you can making a coalitions with organizations that have a different cultures, and you can have someone the different culture inside your organizations that can making a connection with them and help them making more easy to that. Like remember, the cultures have always a leaders, and these leaders can help you to connecting, making trust, making more cultural, and understand better the culture too.
And then another question is, also, do others incorporate those cultural awareness strategies into budget planning for interpreter services, online language services, training, etc.? And again, you guys can answer this so that everybody can see it in the chat. However, I will say Mental Health Transformation Alliance and its programs do include in budgets the expense and cost for interpreter services, language services, either in trainings, meetings. We also, we not only do Spanish interpretation, we do sign language, we do captioning. We make sure that everybody who wants to attend and participate in our services can do it without any barriers and feel comfortable. And so we make sure we have that. We've also had it to where Jessica has actually primarily spoken in Spanish because that is her first language and that's what she's comfortable with. And then it is interpreted into English for the participants. That was not technologically not capable today. So we did not have that. But however, we do make it so that whoever is working with us, partnering with us, participating with us, can participate and feel engaged at the level that they are comfortable and able to do that. Jessica, anything to add to that?
Yeah, and one of the things that I love is the persons that working with the interpretation, they know what they're working with us. Like they know what is the or goals or objects, and they are very knowledge about the mental health, about the IDD, about the everything they're working with us, and that's
And
making a difference.
And there was one last question, and I'll try to answer it in the thing because I know that we're out of time, Brandy. So I'm going to turn it back over to you.
Yes, so thank you, everyone. We are at the end of time. Thank you, Jessica and Stacy, for that informative and excellent presentation. And I think we are now going to be on break until the next plenary session. So thank you, everyone, for attending, and thank you to our speakers.
Thank you.